What clinical assessment tools measure schizophrenia cognition? Imagine trying to understand how well someone's brain is working when they have schizophrenia. That's where clinical assessment tools come into play. These tools help doctors see which parts of thinking and memory might be affected. They are like a set of tests that give a clear picture of a person's cognitive strengths and challenges. One popular tool is the Montreal Cognitive Assessment, often called MoCA. It is a quick screening test that looks at different brain functions like attention, memory, language, and problem solving. MoCA is good at catching mild to moderate cognitive issues, especially in people with schizophrenia. It only takes about 10 minutes to complete, making it a handy choice for busy clinics. Another common tool is the Mini Mental State Examination, or MMSE. It covers basic areas like orientation to time and place, immediate recall, and visual spatial skills. However, it is less sensitive than MoCA when it comes to subtle problems seen in schizophrenia. The MMSE might miss some of the smaller changes in thinking that are important to recognize early. For a more detailed look, clinicians often use the Brief Assessment of Cognition in Schizophrenia, called BACS. This test focuses on areas most affected by schizophrenia, like memory, attention, and processing speed. It takes less than 35 minutes to finish and is reliable for repeated use, especially in research or tracking progress over time. The Measurement and Treatment Research to Improve Cognition in Schizophrenia, known as the MCCB, is a comprehensive battery used mainly in research settings. It checks 7 different areas of thinking, including how fast someone can process information, their ability to remember words or pictures, and how well they can solve problems. The MCCB is often considered the gold standard for detailed cognitive testing in schizophrenia. There is also the Brief Cognitive Assessment Tool for Schizophrenia, or BCATS. It is designed to give a quick snapshot of overall thinking ability in about 10 minutes. It uses 3 simple tests that look at processing speed, memory, and executive functions. BCATS is useful in busy clinics or research studies where time is limited. Interview-based tools like the Schizophrenia Cognitive Rating Scale and the Cognitive Assessment Interview are also common. These involve talking with the patient and sometimes a family member to get a broader view of how cognitive issues affect daily life. They usually take about 25 to 35 minutes and help connect test results to real-world functioning. More recently, digital assessments are emerging, allowing tests to be done remotely. These digital tools can measure how fast someone processes information, remembers things, or solves problems, all through online platforms. Choosing the right assessment depends on what the doctor or researcher needs. Short screening tests like MoCA and MMSE are quick and easy, while BACS, MCCB, and BCATS offer more detailed information. Interview tools add a personal perspective, helping to understand how thinking problems impact everyday life. All these tools work together to give a full picture of cognition in schizophrenia.